Hello and welcome to another edition of Diaspora Weekly. My name is Jermaine Nkrumah and you're watching Diaspora Network Television. Today, it seemed like nobody's talking about anything but coronavirus. And you know what? I'm not going to be different. Today's show is going to be about COVID-19, and we will come at it from a pretty unique angle. And I have no one here in the studio with me once again, but that's just because I made one of those transcontinental calls to interview a very special lady who's in the United States, a Ghanaian doctor specializing in infectious disease, whom you will meet very shortly. But as we always do, before we get into the meat of the discussion, here is in today's jangle, you guessed it, it's also going to be about coronavirus. But I have some questions. You know, this thing is new and not many of us know the real truth about it. And on social media and all over the place, there is information. Some of them are true, some of them are not true. But for me, I have a few questions. And if you're an expert that you're watching, and anybody for that matter, if you have answers, we would like to know the following. We're talking about self-quarantine, okay? You hear the phrase all over the place. Oh, the government has asked people to self-quarantine, okay? What exactly does it mean? All right? Somebody asked a question. The person who's self-quarantined, somebody has to bring him food to eat. Someone has to do something. They're not exactly in prison. So what is done with that? And then we talk about when people are infected, the contact tracing. I never heard anybody talk about family members. And if we're told not to shake hands because you never know who's carrying it, what about intimacy? How come nobody is talking about kissing and sex? How come nobody is talking about that? It seems to me that if you shake somebody's hand and you can transmit the disease and this thing goes through the nose, it seems to me that when you get intimate with somebody, your two noses are as close as you can get. How come nobody is talking about that? Next question I have. How long is a quarantine? Okay, 14 days. What happens when they return to society? You go on 14 days, you come back, you get tested, and you're back into society. What happens next? Okay, I think this disease is going to dramatically change how we live together for a long time until we get a vaccine or something to wipe it out. But until we do, here are these questions. Can people get infected multiple times, for example? Because they tell us that someone can have the virus in him, and for 7 to 14 days of the incubation period, you never know. This person may not exhibit any form of symptoms. And so here's a question. If someone can test negative and get on a plane from China to Norway and eventually bring the disease with them, how do we know that when someone is deemed to have the virus and they go to the hospital, self-quarantine, you name it, and then they get tested, they get treated, and after they test negative, they say, oh, they're recovered. On the worldometer, you see a lot of recovered numbers. A lot of cases are recovered previously infected people. And so the question is this. If it's possible to exhibit the virus and still test negative during the incubation period, is it also possible that when you're deemed recovered to still have it? And because the way we determine that somebody's been recovered is that they tested positive, they went into treatment, and then during the treatment, they tested negative. So is it possible to still harbor the virus and test negative and pushed out of the hospital that you've recovered? So these are questions that I have. And you know, something funny. When this thing came out, they told us, oh, when you're coughing, cover your mouth with your elbow, right? Great. So that you don't shake people's hand with your hand. I get it. But then why do they turn around and tell us to greet with our elbows? That doesn't make sense to me. And so until we know the facts, we need to really be careful about that. Finally, they tell us that alcohol agents kill the virus. All right? So clean your hand with sanitizers or alcohol agents, and the virus will die. Okay. So we also know that the virus goes through your nose, down your pipes, and your throat to get into your lungs, or whatever they explained it. And so because of that, they've advised us to drink hot water and, the water will kill the virus. Well, it seemed to me if you want people to really kill the virus within their system, whiskey would do a pretty good job. How come we're not talking about that? I'm not trying to be funny, but these are questions that, these are not normal times. And so we need to ask the hard questions. And so until we know the responses to all these questions, I submit to every one of us that we need to take time, calm down, and let the experts do their job. And for those of you who are spreading false information on social media, I really want you to sit back and think what kind of damage you're doing to society. It might go around and still come back to you, because we know how this disease works. It goes out and it has a funny way of turning around to come back to you. My name is Jermaine Nkrumah, and this has been The Jangle.
Expecting money from your relations abroad. Have you ever been defrauded of your money remittance? Open an ADB account today. Send your name and your account number to your relations abroad. Ask them to use MoneyGram direct to account service and receive your money in your account in minutes. With MoneyGram direct to account service, there's no PIN code wahala. You can now access your money on all ATMs in Ghana, or send it to any mobile money wallet using ADB mobile banking app or shortcode *767#. Visit our branches nationwide to conveniently receive your Western Union, MoneyGram, RIA, Unitylink, Transfast, and Express Money Transfers. Reach us on our Facebook, website, or call our hotline on 0302 210 210 for more information. ADB, truly accurate and more.
Welcome back. You're watching Diaspora Network Television, and this show is Diaspora Weekly. I was fortunate enough to be introduced to a brilliant lady. Her name is Dr. Bertha Serwa. She lives in Sioux Falls, South Dakota in the United States, but she's been selected as a group of people who are working on this same coronavirus. So as I speak to you, she's in Iowa, and that's where I conducted this interview with her. So I want you to join me to meet Dr. Bertha Serwa. Here is the interview that I conducted with her while I was back in Accra and she was back in the States. Enjoy. Today we're actually very fortunate, and I can't believe that we caught a very good window with Dr. Serwa. Do I have your name correctly, Bertha Serwa?
Yes, Bertha Serwa. Serwa is my middle name. My first name is Bertha.
Okay.
I'm actually Serwa Bonsu. Yeah, Serwa Bonsu. And my last name is Ayi.
Serwa Bonsu, okay. Okay, yes. So Serwa with one A, and I know it's like, so I thought it was a different Serwa. Okay, very good. Welcome.
Thank you.
All right, I'm looking at your resume, and I'm telling you, we don't have enough TV time, TV minutes to go over a lot of the things that you've been able to accomplish in your professional career. So let me just say congratulations for what you've been able to do with your career.
Thank you.
Very good. The part about your resume that caught my attention is that it says you're infectious disease specialist. Can you please tell
Right.
us about that and take the opportunity to also tell us about yourself?
So, thank you. An infectious disease, first of all, I finished medical school in 97. And then I did 3 years of internal medicine training, which would be like the adult's physician, meaning you can take care of diabetes, hypertension, every medical problem for which you have to seek care from an internist or a doctor. And then I did 2 years of specialist training in infectious diseases. So on a day-to-day basis, I work. Infectious disease specialists are extremely busy people because if someone comes into the hospital with a pneumonia, a fever, malaria, HIV, or something that the other doctors cannot understand or figure out, we're called upon. So we're like the doctor's doctor. We come and figure out what the doctor cannot figure out. So a lot of our work is diagnostic, trying to understand why not see what's wrong with this person, especially if there's a fever. About 20% of the time, maybe the physician already knows what's going on, but they want to make sure they've got the treatment correctly. And because by virtue of our training and our continuously updating ourselves, we know exactly what to do. And then about 10% of the time, we're also doing what we call hospital infection control, making sure that people who come into the hospital do not leave an infection. So all those things fall under the jurisdiction of what an infectious disease specialist does on a day-to-day basis. And I've been doing that for the last 16 years. Yeah, I graduated from my fellowship in 2004. Yes.
Oh, okay. Well, then, so when this pandemic, it caught your attention because that's right down your alley.
Exactly. That's right down my alley. So it caught my attention. And like I said, even though this is a new virus, because I'm an infectious disease specialist, I quickly have to read about it, learn about it, keep updated with the latest information from WHO, CDC, or any new journals that have been written about it. That's my job, because if somebody comes into the hospital and people are not sure whether they should test for COVID-19, they're going to call me to see if the symptoms fit. So I quickly have to know the whole clinical spectrum of the disease so I can manage or advise that, okay, this person is mildly ill, they can go home. This person has pneumonia, they should be kept in the hospital. Or maybe this patient doesn't even fit the criteria for testing. So that's what I'm doing currently, so far as the disease is concerned.
Very good. Your name Serwa suggests to me that you're Ghanaian. Is that correct?
Yeah, I'm Ghanaian. I'm actually from the Ashanti Kingdom. My great-great-grandfather was an Ashanti king called Nana Mensah Bonsu the Fourth, I believe.
Okay. All right. And you're currently doing what? And you're currently, where are you and what are you doing? I said currently, where are you and what are you doing?
Oh, I live in Sioux Falls, South Dakota, but I'm physically in Iowa, in an area where we're overseeing and managing COVID-19 patients and other patients with issues.
Okay. When was the last time you were in Ghana?
I was in Ghana in February. I was actually supposed to be there now, but because of all that's going on, I just had to postpone my travel.
Okay, so when you come to Ghana, since it's your field, I'm sure you take a very good look at our medical facilities and our preparedness. Is that correct?
I don't exactly do that, but since the outbreak, I was writing a paper for the Infectious Disease Society of America. They asked me to look at outbreak preparedness in developing countries. And because I come from Ghana, I chose to write about it and ended up interviewing people and finding out the state of preparedness.
So where would you where would you place Ghana based on what you know about our medical facilities? And I know you may not have looked at it from a critical perspective with regards to COVID-19, but based on what you know generally about our medical facilities, where would you grade our preparedness on a scale of 1 to 10, with 10 being very prepared?
And I won't say that I haven't looked at it critically, because I have. I actually wrote an article about it, looking at world preparedness, and that my topic was, can anybody even be ready? Because look at the States, you look at Italy, you look at China. These are all countries that you would think would be super, super prepared. And my assessment was nobody's ready. I mean, even America, that's what they're dealing with. They're like, we're not ready. And they're not ready because of the size of their population. And if you talk about preparedness, I would say there's a 10-pronged strategy to the preparedness. The first one is a state of mind. It's an understanding. Anybody who is advising a government on COVID-19, you need to understand the illness. So it's like a mental readiness, and then you can get physically ready. So I'll talk about the physical readiness. But the first thing you have to understand with COVID-19 is that it has an R0 of 3. R0 of 3 means that for every single person who gets infected, they would infect 3 other people. So that's the first thing. The second thing you have to understand that it has a long incubation period of 14, average of 5, but mostly 14. What it means is that when somebody gets infected, for 14 days, they are potentially spreading the infection, but they don't have symptoms. A good example is Idris Alba and Kevin Durant. They're positive, but they may not have any symptoms till maybe a week or 2 down the road. During this period, they are having symptoms, okay? And the third thing you have to realize is that by the time you have 1 case, meaning somebody who has symptoms, you have to assume you probably have 10 times more. So right now, Ghana has picked up 11 cases. We have to assume we have 110 who haven't been discovered or who are incubating illness. So that is the mental preparedness. So let me talk about the 10-pronged preparation I was talking about. The first point is every nation has to be ready and quick to detect your first case, because if you don't detect that case, it's the one that is going to give rise to hundreds of cases. And a case in point is New Rochelle in New York, where one attorney was able to infect 100 people. And so they had to call the National Guard to this city because the outbreak was just unbelievable. You take South Korea. One woman went to a church and infected 1,100 people. And today that church makes up 60% of South Korea's 8,000 cases. So that's the first point of it. So that number one is detection. Is Ghana good at that? Yes. When you get down at our airports, we have the health declarations form where you fill out your symptoms and a temperature is taken. Now, studies from New York and several places have realized that the temperature is useful. It's a good prop, but it doesn't, like in the US, it had only picked up 1 patient or so. It's not very reliable because not everybody is going to have a fever. But the health declaration form is very useful in that it's able to pick people with disease. The second thing is, in detection, is what about the people who are already in the community?
If I may, the health declaration form, we're relying on the candidness of the person filling it. So how useful is that versus the temperature?
I mean, it forces people to think. And I think, I'm trying to remember which country, whether it's Ghana, but it's been found to be more reliable. Actually, people go home and because they filled it, they start asking themselves. I mean, I don't know if it's Ghana, but one gentleman went home. I believe he's in the US. He went home after he filled the form. And when he developed symptoms, he came back because in a way, it's almost educational. When you're having to feel headache, fever,
okay.
You begin to think, oh, if I go home
and it also keep track of those who might be coming in, so that if there's anything
it makes tracking easy. Okay. All right, go ahead, please.
And then something else I found out yesterday, some people in Ghana, and I don't know if they're related to the government, they've come up with a website called COVID-19ghana.miph And what that place does is it allows everybody to become a detective. If you see somebody that you suspect has it or is ill, you go in and enter the information and they pass it on to the healthcare authority. So in terms of detection, I think we're good. The next piece after you find the person is to make sure you've done contact tracing, because you need to find all the people involved. So that, I think Ghana has employed people. I don't have much detail on that, but it's going to be difficult in a country where people live in compound houses and so forth. But these days, I know Ghana is working on a GPS system. Like you can locate anybody anywhere if they have that software. So I think that should be useful. One case in point is the woman who died in Kumasi. In the end, we found it wasn't COVID-19, but she had sat on a VIP bus and then she died. So what if it was COVID-19? How are they going to find all the people she sat in the bus from Accra to Kumasi? So it became necessary for the Ghana Health Service to start working with the transportation system to force people to put their phone numbers and email down for tracking. So isolation, contact tracing, and then case management. Now, this case management is when somebody is acutely ill or they're ill. How do you take care of them so that they will recover? And then secondly, that you make sure all the doctors and nurses who fortunately or unfortunately have to take care of this patient do not get sick. So this has been the area where people have been talking about, are we ready? Are we ready? Because in Ghana, as of now, well, let me put it this way. So the disease has 3 forms. 80% of people will have mild to moderate illness. Mild means a little cold here, I don't feel good, but you don't have a pneumonia. The minute you have a pneumonia in your lungs, it's moderate. And then the severe ones are the people who crash quickly, their blood pressure is dropping, they can't get enough oxygen, and they need a ventilator. That in that area, I have to confess, Ghana is extremely limited with or without COVID-19. Because in Kolebu, for example, I believe we have 3 intensive care units, and they have a maximum of 37 beds. In Tema General Hospital and Accra Regional, that were designated as our 2 treatment centers, between the 2 of them, they had about 10 ventilators. And now I believe all the the 16 administrative regional centers also have treatment centers designated, but I don't think they have ventilators. So the bottom line is, and I said this a month ago when I wrote an article about it, and I wouldn't change it, I don't think Ghana can handle more than 100 critically ill cases if that should happen. Some will not go with the ventilator because, for one thing, we don't even have the manpower to be manning those ventilators, and we don't have enough of it. Assuming China came and dashed us 1,000 ventilators, we wouldn't know how to manage it. Fortunately, Ghana has trained enough critical care doctors outside the country who have verbally told me that they are willing to log in electronically and manage the ventilators if we have to. The next piece is, after case management, making sure that in the community itself, you are containing it. You are making sure that all undetected patients are being monitored. And so those are all pieces in the preparedness pipeline. And of course, for preparedness, you have to have a very good communication system, which I don't know how effective that is in terms of, if I find somebody, I'm going to call right away. That, like, I know yesterday, Dr. Anafi Ban also was appointed as the coronavirus task force for Ghana. There should be a system where as soon as somebody even
in Ghana, they
in
don't use
Baku,
right?
I'm sorry?
I said basically the coronavirus czar, but they don't use czar in Ghana. So
Right.
Anyway, go ahead. I think. But what I wanted to ask you is this notion that because we're in the hot temperature zone, we are not as exposed as our, people in colder temperatures. How true is that?
That's not true. You just have to look across the equator and look across the belt. Thailand, India, Bangladesh, they all have cases. I mean, you see, this is a notion that has to be rapidly done away with, like you would heat water and it will evaporate. If we don't let it evaporate at lightning speed, it will catch up with us like Italy. Because you know what is happening? Europe was watching China far away and thinking, oh, this is a Chinese problem. Let's look at them. And then in the midst of the Chinese outbreak, Italy and all these countries that are being called the epicenter, they were allowing unlimited flights from China to mainland Europe. It's only March 14th that the European Union shut down, or was it March 16th? They just decided to close Europe. That should have been done February 2nd. And it was I have been calling for closing of these borders since February 2nd when I did a show on Joy FM with Professor Ampafu. I was saying that every country needs to shut their borders now. Don't let the Chinese into, not because I have anything against Chinese. I knew these things, that if you keep people coming in from an infected area, very soon you're going to have an outbreak. And now the epicenter is Europe. The next epicenter is America. I mean, the minute, because of the things I mentioned.
That brings me to the question. When this virus started in China, there were a lot of calls from politicians in Ghana, go and bring our people back home, and the whole world. I think, and I might be wrong, but I think for political expediency, to score political points, leaders around the world felt like, hey, let's go bring our people home because this thing is happening in China. Had every country kept their China, because it appeared the Chinese was doing a heck of a job at meeting this challenge. Had every single country kept their citizens or their nationals in China, would we have the problem we have today?
I don't think so, but that wasn't the only.
And so because the long information.
Mm-hmm. I also think that people were allowing, I mean, okay, so for the US, for example, evacuating people from China was a factor because they introduced 45 positive coronavirus patients into a fertile, non-immune population. So that was one. But I think the cracks too, it wasn't like just the evacuation brought the disease into Europe and America. I think that the fact that people were still allowing unlimited flights from an area where there was disease. Yeah, I mean, like Kenya, for example, was still continuing flights from mainland China. And I'm thinking, and you know what? I don't blame anybody. People who understand the disease should have been talking to politicians or decision makers. Because even me as a physician, it is the amount of noise I've made that has allowed some physician friends to wake up, those who are disease doctors, to wake up to the fact that, maybe this is a problem. Because it's sort of like the California wildfires. If you're in Ghana and you hear there's wildfires in California, you just watch it on television, right? It doesn't even cross your mind that one day you'd have to deal with it. Does it even cross your mind?
Yeah. Yeah, no, it wouldn't. But I think you bring a very important point that, I mean, keeping your people in China was one thing, but did we understand the disease enough such that if we had said right from the onset, no, nobody is coming anywhere from, nobody's leaving China, period, right? Wouldn't we have been accused of overreacting?
No, you see, so that is the thing about COVID-19. If you act appropriately, it appears like you're overreacting. It appears like, so on February 2nd, and I'll say it again because today is March, today is the 20th, right? Yeah, today is the 20th.
A month and a half later, yeah.
No, so today is the 20th. 7 weeks ago, I was on radio saying Ghana needs to stop Chinese people from coming in. In the end, it wasn't China that brought disease to Ghana, it was Europe. But the point I'm making is if every country had seen, so the analogy should be, okay, the fire is going on in California, right? You don't think it will come to you, but if somebody comes to your home and tells you that, Mr. Jermaine Nkrumah, this fire in China, if you don't shut your, in California, if you don't close your door, it would come to you. At first, you might say, how is a fire going to leave California to come to me? If the person explains that, well, people from California carry little batteries in their pockets, which is, let's say, the virus. Once they get close to your door, they can come in. If you get that understanding, even though the fire is in California, you will tell your neighbors, look, let's shut our doors. They may not understand, but they'll get it. So that was the decision that should have been taken 7 weeks ago from Europe, from America, and from everybody else. And I give a thumbs up to America. On February 2nd, America said nobody from China is coming in. But even in spite of that, look at their situation now. If they hadn't said that, America would even be worse than Europe right now. But they put a stop to everybody coming from China. So let's bring it locally. So far as Accra and Ghana is concerned, this weekend, I'm very, very happy because we finally done what I said 6 weeks ago. Let's stop flights coming in from Europe and China. And we can see the evidence. All the 11 cases we've had, I don't know if it's changed this morning, they are all imported cases.
But guess what? Guess what? Now what do we do? Because just after I started this conversation with you, Ghana has gone up to 16 cases.
And
there's been 5 more added this morning.
Yeah, even the 16 multiplied by 10, the reality is we probably have 160 people infected. You see, the 16, this is the illness, mild, moderate, severe. The mild ones would not even go to a doctor because they don't even know if they have it. Maybe they have a headache, a fever, they just came from Italy or Germany, they're at home. The 16 represents the moderate to severe, moderate who would come and say, you know what, now I'm ill. Because the lady who was, I believe, our 7th patient or 6th patient, she had come in on March 10th or March 6th, but she was at home until she got ill enough. Until people get ill, they don't show up. So even though we're recording 16, we should assume we have 160, and you should assume that 160 would spread to 3 other people. So you have to start planning for 500. So clearly, we don't have enough ICU beds if those 500 people. So here is the thing about COVID-19. As you're going through this thought process of planning, you have to assume all those 500 people in 2 weeks, they will suddenly show up at your hospitals. So when you're planning, you have to start thinking, do I have enough beds for 500 people if they should all show up? And so I've always said this, that the minute you get to 1,000, just know that you've reached epidemic stage, and every day people are going to be showing up in your hospitals. Then the other part of preparedness is whether you have enough protective, personal protective equipment to take care of all those people who would come in without infecting your few healthcare workers. And in the US, yesterday, they're telling doctors to start reusing masks.
What do we do?
What we need to do is, what we need to do is, number one, the first thing is detecting of our cases. At this point, the criteria for testing has to change. I'm not even suggesting, it needs to change. At this point, we're only testing symptomatic cases. We're setting ourselves up for trouble. We need to start testing their contacts as well. This is how Nigeria picked up their second case. They were testing the 100 people who came into contact with the Italian who came into the country with their first case. We are not even testing, and I'm going to be open. The Norwegian ambassador who tested, I understand his wife is not being tested under the pretext that she doesn't have symptoms. You only do those things when you have a lot of patients and you're overwhelmed. when you are a country like Ghana and you have only 16 cases, you have to be aggressively pursuing disease. I mean, how can she not be tested? She has to be tested. You have to test as many close contacts as possible. So we need to be aggressive with case finding, and we need to start looking at buying ventilators and looking at which hotels, which hospitals we can use if we suddenly get into a surge of cases.
79,000 US dollars only to buy you a studio apartment in Accra. Why not come to Whaley for a spacious 2-bedroom apartment at Alphabet City, our brand new gated community situated right on top of the serene Sakomano Lagoon, feeling like splashing a little. Check out our exclusive all-detached house gated community, the Jaden Symphonic next door. Sizes ranged from cozy 3 bedrooms to luxurious 5 bedrooms. We at Whaley are committed to provide you with the best building quality and value for money. In fact, we are the proud recipient of 2019's Quality Property Firm Award. Just like our homes, our payment terms focus on your need. Choose from installment up to 24 months or take advantage of mortgage up to 20 years. At Waylead, we build home for you. Call us now at 0240-111119 or 0504-499999 to secure your dream home now. Hello, my name is Kofi Upon Ochre, and I bring you NASA on DNT, a program designed to expose corruption and indiscipline in our society and advocate for the punishment of these offenders whose activities impede national development. The National Road Safety Commission indicates that Ghana loses $230 million to road accident, with over 1,600 deaths recorded every year. In 2018, Shraj report indicated that Ghana loses 13.5 billion Ghana cedis to corruption. And United Nations Children's Fund UNICEF has also stated that Ghana loses $290 million to poor sanitation alone. This is not right. So make a date with me, and together let's name and shame the offenders of the law. NASA, see something, say something.
Lock up Hello Entertainment Box.
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 Welcome back. Looks like we're getting some pretty good insights on this coronavirus. I mean, as we talked about, look, we talk about locking down or maybe closing borders or shutting down airports and stuff. But then we also turn around and say, oh, but our citizens are welcome home. It seemed to me that at a time when the Ghanaian students were in China and we said, do not bring them home, otherwise they could bring the disease along with them. And Ghana and many other countries made the right decision not to bring them back home. It seems that we're getting back to that same emotional state again. If you're closing your borders and you're saying that your citizens can come home, how different is it from saying that our citizens are elsewhere and we have to evacuate them? Let's hear what Dr. Bertha Serwa says about this.
We're here now,
Okay,
and now we have this problem on our hand. What you're the specialist? What is the recommendation?
We need to start testing our asymptomatic contacts. Even if we're not going to be randomly testing people.
How would you find them?
Oh, it's very simple. If somebody is married to another person and the person is infected, you have to test the spouse. You don't have to say they don't have symptoms.
Okay.
And so every one of the 16 people who are the 16 cases, their wives and husbands have to be tested. Their children should be tested. We don't have to leave anything to chance. Maybe we're not going to test the taxi driver who picked them up. I mean, it looks like we have over 400 contacts we're tracing. But we don't have to wait for that. You have to at least test the people close to them. And I've heard that the Norwegian ambassador's wife has not even been tested. That's wrong. So we need to do that. Secondly, we need to start looking at hospitals and hotels and places that we can use if our cases get out of control. And we also need to purchase some ventilators and stock up on protective equipment. Okay,
very good. Now, I think what you're saying is sort of like a circle. If you have a confirmed case right in the middle of the circle, the immediate circle is the family members with whom he definitely would have come into contact with. And then there's other peripheral circles all the way up to the person who merely looked at him, okay? So what you're saying is that when we find a confirmed case, we need to test everybody in the immediate circle. Is that correct?
Exactly. You know, maybe 4 weeks from now, when we have a lot of cases, we will be too busy to do that. But my point is, if you have only 16 and you have a lab that can test, what is your excuse for saying that their wife doesn't have symptoms? That is just wrong. It's completely wrong.
Yeah.
And that's what we're doing in Ghana. We're not testing the criteria.
So the criteria for testing is what you're recommending that should change, because as of now, they are inviting people to volunteer to come and test. So even if I have any contact, I can just walk in, and then we're using up resources that we could have used to test people within the angle of confirmed cases.
Well, again, my information is about 4 days old, so it's possible that it has changed. For example, I didn't know about anybody can walk in and come and test. So maybe it has changed. But when I heard it 5 days ago, I freaked out. I'm like, what are we doing in Ghana? I mean, we can't let their wives just be there that we're observing them. That's absolutely not correct at all, to put it mildly. Okay. So we need to test the people around them. And secondly, we need to start looking at ventilators, buying some ventilators, finding out which individuals can man our ventilators. Even we need to start talking to hotel owners that if the hospital system becomes overwhelmed, because that's what's happening in Italy and America. In Italy, they had to be turning people away. South Korea, go home, we know you are sick, but we don't have a bed for you. We don't have to wait to get to that point. Wow. We have to identify about 20 hotels that can potentially be turned into hospitals.
Interesting. That's a very, very interesting angle. All right. So now, here we are. When you look on the horizon, what do you see?
What I see is that I'll start from the end and I'll get to the middle. At this point, this week, I've gone on social media and I'm telling everybody the world needs a complete quarantine. We need to lock down the world. And today I was happy because when I woke up, or better still, before I went to bed, the whole of California is in lockdown, meaning the California governor, 3 days ago, people were still on California beaches when they had been told to do with social distancing. So what I see is that we need to move from social distancing to lockdown. The California governor has said everybody should stay at home. So 40 million people, the streets of California are empty. And then the Army and Navy and whatever have been called to enforce it. People need to stay in their homes and not be anywhere else. The only people who should move around are doctors, nurses, healthcare workers, people who are delivering food. That is the only thing that will break this epidemic. That is why what Wuhan, China was able to do. That is what Macron has done in France, and that is what has done in Italy. Fortunately, most countries are locking down their borders, which is good, but we have to have an internal lockdown, and it has to be the whole world, and it has to be coordinated, meaning it's not just California on March 19th, locking down California, the whole world needs to agree from April 1st to April 30th, we want to lock down, everybody stay in your homes. If we did that, Jermaine, this epidemic will end quickly. And you know why? I can see it. China has done it. Vietnam has done it. And in those days of the bubonic plague, when 200 million people died, you know what they did? They did something called quantaguri. And quantaguri is the Italian word for 40 days. That is where we get this expression quarantine. Quantaguri. If you are a ship coming to a mainland, you are supposed to stay out there for 40 days, because the thought is that even if you have infected people on your ship, by the 40 days, they will either have died or recovered. So you will come on land with only healthy people. So at this point, the world is ready for another quantaguri. So what I see happening is that gradually countries will start locking down, like Italy has locked down, France, the whole of European Union has locked down. African Union has to lock down. African heads of states have to get together and lock down. If they do that, this epidemic will end.
Okay, then my question is lockdown realistic in Africa?
We have to use, who would have thought, how can California go on lockdown? Have you been to California? That is where you have Los Angeles, Hollywood, San Francisco, the beaches. How can they have lockdown? But they do. I don't know if you've been to France. It's the romantic nation. Everybody is kissing in parks. There's people holding hands. You think France cannot go on lockdown, right? But they have. They've employed 100,000 soldiers.
I know, but you see, these are societies where controls and law enforcement are in African countries. Most African countries, my friend even said the laws are just mere suggestion. You have people that the means to communicate to them, the law enforcement personnel to enforce a lockdown are simply non-existent. So what do we do?
No, it's not true. Jermaine, were you there during Rawlins's time when there was curfew?
Right.
Did you see a bird on the streets?
Well, I was.
Did you see any bird on the street?
That was a threat of.
Okay, but what I'm asking
that was
you
a threat of being killed.
Exactly.
That was a threat of being killed.
But that is what a lockdown means. You pull out your soldiers on the streets and you tell them, human beings will never go on lockdown if you ask them to do that. A lockdown is an enforcement. That is what is happening in California. That is what has happened in New Rochelle, New York, and that is what is happening in France. You cannot have a lockdown without law enforcement. If Ghana was able to have curfew after 6 p.m. during Rawlins's time, you could hear a pin drop. Nobody stepped on the streets. If we can enforce a curfew during Rawlins's time in Ghana, we can do it. Unless, you see, if you understand what is happening, if everybody understands that, look here, if we don't obey the soldiers, in about a month, about 7 of my family members would die. If we get that understanding, people, after all, what is, it's just a matter of, I'm in my house, I'm not opening the door. It doesn't matter the community. It doesn't matter at all. Okay. If you decide you will stay at home, you can't stay at home.
Okay, the pharmaceutical industry, there's a race to get a cure, or shall I say treatment for COVID-19. How is that looking?
It's looking good already. From my reading and putting everything I'm reading together, about 283 companies are testing for the vaccine. Now, at this point, you call them trial vaccines. If you read on the internet that somebody said they found a vaccine in 3 hours, that is a lie. Maybe they found a chemical that can be used, because you have to go through about 3 phases of testing. You have to test it in, first of all, Chinese made the DNA available on January 12th. So immediately, any lab that was already developing vaccines can come up with a vaccine or something that looks like the virus, which can trick the body. That's essentially what a vaccine is. You don't put the real thing. You trick the body into thinking that it has seen the virus so that it will produce antibodies. So about 283 companies are working on a vaccine, but they have to test it in animals, which can take anywhere from 6 to 8 weeks. Then you have to do phase 1 trial in human beings, and that will take several days as well. You need about 25 people. You want to check on the side effects and make sure it's not going to harm anyone. Then you go to phase 2, where you're looking to see how effective the vaccine is in real people. And then before it even comes to market. So you're looking at approximately 1 year before a vaccine would even be available. I know in the US now, one of the vaccines has reached phase 1, meaning it's been 3 months or 2 months since the outbreak. So they probably finished their animal studies and they're going on to test it in about 25 people.
Yeah, I mean, you talked about the process of testing before it gets into the market. And I was saying that the question that I asked before we lost each other was that, do you think because of the magnitude of the pandemic, the process will be rushed, get a vaccine out quickly?
I don't think you can even rush the process, because the last thing you want is to have a vaccine that is making people sick or causing more difficult. In medicine, the rule is do no harm. Like if somebody is there and they're going to get sick anyway, don't add harm to it. So I think they won't rush it, because the issue is not, you see, people are always to jump to a vaccine is never a problem, a solution to an acute problem. It's vaccines are good for chronic, like polio vaccine, but this one, that's a good public health solution. If you ask people to sit at home and you're taking care of the sick, you can solve it. Because as soon as a vaccine comes, like the malaria vaccine, it's going to be expensive. I don't even know if people can afford it. Immediately the issue will come, who is paying for the vaccine? So, I mean, it's important. I don't think that they would want, you cannot really rush a vaccine that way. It still needs to go through efficacy studies. You need to check if it's going to work. So I don't think one will be ready in 6 months.
Then let me take you back to China. China, by all accounts, has solved the problem, but it hasn't taken a year. This thing started about 3 months ago. And I just read somewhere, No,
China hasn't solved it.
Okay.
They've decreased the number of new cases. They've decreased the number of new reported.
I think a couple of days ago, they reported a day of new cases.
No, yeah, the absence of a new case. Yeah. But that doesn't mean they've solved it. I watch the news and I'm thinking, if you're not a clinician, you think, oh, China has not solved their problem. They've reduced, and it didn't come easy. They used soldier method, the same method you and I were talking about may not work in Africa. Hubei province, which had 80% of the cases in China, is still under lockdown. You cannot go out into the streets just like that. Do you understand what I mean?
Okay.
It has been something. You see, in this world, the works on cause and effect. You can't look at somebody's effect when you are not ready to do what they did to get that result. China has not solved their problem.
Absolutely.
They have reduced. Yesterday there was no new report, but the day before they reported 30 cases. The day before that they reported 24 cases. 24 cases. Do you know what it means? Now remember what I told you about incubation period and the fact that it takes 14 days for someone to show symptoms. The fact that yesterday was 0 cases. The day before was 30 cases, right? New cases. Now I told you multiply that by at least 10. There are 30 cases means that somewhere in China, there are 300 other people who are gotten newly infected, and in 2 weeks, they will come up as new cases. Don't forget that China is not done. And that is why the president is smart enough not to take Hubei province out of lockdown. And I will keep saying this to you, and I will say it to anybody who will listen. If we don't do what was done in Hubei province, this pandemic will not end. It will not end.
Okay, very good. And so one of I'm gonna send you a chart, and I'm gonna put it on the screen. And I'm saying that because when we air, it will be shown on the screen. It's a chart that we developed over here in DNT, where we took the 15 worst cases, 15 worst countries COVID-19 cases. We tabulated their average temperature, and then we took the 15 least cases. In fact, the countries, most of them 1 case each at the time we did this. And we also tabulated their average temperatures, and we found that the difference between the temperature of the worst cases and the temperature of the least cases were about, let me see, I think about 19 degrees Fahrenheit. So why is temperature not an issue?
You know what? When it comes to temperature, you forget about even Ghana. Come to America, okay? Let's just look at influenza in America. What happens? People stay indoors, right? People don't go out. You tend to breathe into each other's faces. These things are droplet-borne infections. So whenever winter is approaching from, I believe, October 1st to March 31st, it's called the influenza season. People transmit influenza, okay? Now, if you told me that below a set, you have a difference of 90, it's not 69. You're not telling me that in places that there's no outbreak. Otherwise, Ghana wouldn't have 16 cases today. So the temperature issue to me is just a confounding factor that reflects behavior of people. Now, take places like Thailand, Bangladesh, all these places, they are relatively warm at this time. They have outbreaks. And now let me take you to a cousin of COVID-19, the MERS outbreak, which is still ongoing, MERS and SARS. All these MERS cases, they are coronaviruses. And I have a paper I was looking at yesterday. They actually took the temperatures of the cities in, it was Qatar, Saudi Arabia, Jordan, Kuwait, and other Eastern. They were all warm, and they happened when the temperature was fairly okay. It was between 70 and 90 degrees or so. They were still having coronavirus outbreaks. The other thing you have to remember is that these things, they don't sit on a surface waiting for you to pick it up. People are breathing it. It's a droplet infection. So you inhale it into your lungs. So even some of the videos going around, I don't even have time to address it. Things like if you inhale hot air, if you use a dryer, you wash your nose, all those things are bogus. I mean, if you do that, you will just be doing that and you will catch the infection. In fact, I think they increase your risk of infection because people keep manipulating their nostrils. Listen, Jermaine, the body temperature, you see, the body temperature inside of you is higher than even the one on your skin. And the one on your skin in Fahrenheit is 97.6 degrees Fahrenheit. In degrees, it's about 37.6. If the virus can multiply inside your lung at 37.6 or 97 degrees, and your outside temperature is 70 or 80, tell me how that is even logical that we're using temperature as a means of saying the virus cannot survive. Do you understand the logic I'm making?
Good.
Inside your body.
I know. And I just saw a chart right now of United States cases. The 3 states with the worst cases are New York, Washington State, and California. And we know California is a pretty hot place. So that
Exactly.
nullifies that argument.
I don't even know where the theory, and you know what, apart from that, they've done studies on these viruses, this particular COVID-19. A study just came out about a week or two ago. It's able to survive from 22 to 33 degrees for 14 days in those areas. Now, 22 is about air-conditioned room, 71. It can survive for 14 days. So I don't know where the theory came from, and I don't know who started propounding it. It is not true. The only thing that kills this virus, I wouldn't say the only thing, so far as temperature, it dies at 56 degrees Celsius or 70. You know, if you cook food or if you boil it, it will die. That we know, but that's a lot of heat.
Okay.
I mean, 70 degrees is about 156 degrees Fahrenheit. I mean, I don't know who would even want to touch tea that is that hot. You know, that is what it takes to, and then it can survive at minus 20 degrees for 2 years.
Look at that. Look at that.
Yes.
Okay. So finally, at the personal level, if you're in Ghana today, we know your number one recommendation is stay at home. If you're not in a position to do that, and also I'll include the people who don't have the luxury of staying at home, who have to be part of the solution, what are the personal behaviors that you have to exhibit, the precautions that you have to stay safe away from this COVID-19 virus?
Okay. So what I will recommend will be a step down for the total lockdown I've been talking about, the enforced stay at home. The social, when we say social distancing, it means cancel all your meetings, which in Ghana, the government has done it for us by saying no church. Because they didn't do that, people will still want to gather and pray and do all the things that we do in church. Cancel all your unnecessary meetings. Don't go out to do anything if you don't need to go out. You know, and then of course, good hand washing. And I know the hand washing and the cough is like, that's what everybody says. But my situation is this. If you don't have somebody with COVID-19 around you, the hand washing is useful but not important. The other thing to do is, if somebody lives in your house and they have COVID-19 and they've given it to you, you can wash your hands 2,000 times a minute. It's irrelevant. If it was just hand washing, Italy would not have this outbreak. Yeah. If it was just hand washing, America, because America, where you go, there are taps. There's water everywhere. You know, China wouldn't have an outbreak. It's not, so cancel unnecessary meetings, because 16 cases means there's now community spread. People who haven't traveled are getting the infection. Cancel your meetings. Make sure you are also, everybody should become a detective. If you see somebody around you coughing with a fever, report them to the authorities or go to this website that they've just created called covid19gh.miphconsult.ml. Go there and report so that they'll come and find the case before the person infects everybody. So people just have to be vigilant. And of course, I'm a Christian, so I can't do away with saying, let's all go down on our knees and pray. Because the Bible says, if my people who are called by my name, they will humble themselves and pray and seek my face, I will hear from heaven and I will heal their land. You know, there was a time when God sent snakes among the Israelites. I think they disobeyed him. And the snakes were biting people. It was like another epidemic. This time it wasn't a virus. It was an epidemic of snakes. God told Moses to put a snake on a rod. Anybody who just looks at the snake, I don't know how that worked. It was, I don't know, it's infrared or ultraviolet or whichever spectrum of the UV light God used. He just said, whoever looks at the snake will be cured. And that's exactly what happened. So I will ask people to be praying as well, in addition to taking all these measures, and pray for our leaders. They need to make good decisions for us. You know, you are as good as the leaders in your country. If they don't make good decisions, it will affect everybody. So pray for the person who has been made the czar of coronavirus. Pray for the president. Pray for his cabinet, and pray that whatever they do, they will keep the country safe. And also, I thank the president for everything he's done, being one of the first African countries to put a barrier around our country, put the country on lockdown, lock the churches, lock the bars. We not thank him. We thank all the people who are also working on the coronavirus outbreak in Ghana.
Thank you so much for your insights. I think you provided us with a very important educational materials in the COVID-19 pandemic. We hope to be able to call on you again, Dr. Bertha Serwa.
Yes.
Is that correct? Thank you so much.
Yes.
And you have a blessed day.
You too. It was a pleasure to speak with you, Jermaine. Thank you.
All right, welcome back. I have to really thank you. This has been an amazing conversation. I have to admit that before I got into this interview, there were some things that I had not thought about. But I have to admit that I've been educated, and I hope you have been as well. This has been Diaspora Weekly, and I want you to help me thank Dr. Bertha Serwa for providing us with these beautiful angles. I want you to stay very careful, practice social distancing. At least we're getting a bit of information about how this virus is transmitted. There doesn't appear to be any completely safe thing to do to exempt yourself from contracting the virus. But all I can say to you is that be careful. If you have a pretty good idea of how this virus is transmitted, use common sense and practice, live differently. And hopefully, by the time we get a vaccine and this virus is no longer a threat to the whole world, we'll all be alive, and hopefully our personal hygiene would have been improved dramatically. My name is Jermaine Nkrumah, and this has been Diaspora Weekly.